The whistles and bells are moving and turning and chiming and everything else around here. Welcome to the Maricopa County News Conference on this December 7th. We appreciate you being here. My name is Fields Mosley. I am the lead public information officer for the Joint Information Center, which is a part of the Unified Command during the COVID-19 response. I'd like to thank all the reporters that are joining us out there, either on YouTube, Facebook, or on the webinar today to ask some great questions. We appreciate that. Thank you to members of the public who are also joining us as well. We appreciate you being attentive to these matters and getting the latest update that we have for you today. So speaking of that, today we're going to hear from Executive Director of Maricopa County Department of Public Health, Marcy Flanagan. She is here to give us a brief presentation about the plans for COVID-19 vaccine distribution. This is thousands of doses, of course, are going to be coming into the county over the next month, and then hopefully ramp up after that. She'll address a little bit of those things, but it's important to understand this has been a very complex undertaking. It's required hundreds, if not thousands of hours from our medical partners out in the community, as well as members of the Unified Command, our Emergency Management Department, and the members of the public health staff as well to ramp this up, communicate with all those partners, and then get ready to deploy the vaccines. So the plan is likely to evolve over time, so what we say today, it may have to evolve as more vaccines come online, and Ms. Flanagan can address that a little bit more. Also with us today for the question and answer part of this, if you have questions about the planning structure, PPE, Unified Command, Robert Rowley, the Director of Emergency Management, is with us as well. And of course, I have Joanna Molina, who will translate the answers into Spanish for those members of the Spanish language media and the community speaking Spanish as well. So a few housekeeping matters that I always go through. Members of the media, when we get to the question and answer portion, please virtually raise your hand on the GoToWebinar. If you're having a little bit of trouble with the software, you might have to log back out and then log back in. So please take a look at that and make sure we can see it. We will unmute you on this end, but you need to make sure you have your mic unmuted on your phone, your laptop, whatever you're using to communicate with us today. And we'll get to your questions. Please ask one, maybe two questions at the very beginning, and we almost always have time for follow-up questions, so we'll get to as many questions as we can during this hour. So with that, I'd like to invite Marcy Flanagan, Executive Director of Maricopa County Department of Public Health, up to the podium.
Good afternoon. Thank you, Fields. This morning, I gave a presentation to the Board of Supervisors with an overview of Maricopa County plan to distribute COVID-19 vaccine. No vaccine has been approved yet, but we do expect to know if Pfizer is approved this week and Moderna next week. We will begin distributing initial doses of COVID-19 vaccine to those at highest risk of COVID, healthcare workers and residents of long-term care facilities. This is based on recommendations by the CDC, ADHS, and our local partners representing various health-focused fields. By protecting healthcare workers from providers to long-term care staff to cleaning crews, we are protecting those who have the highest exposure and whose health will help preserve our healthcare system. We know that our hospitals are under immense strain right now. Protecting healthcare staff keeps hospital beds staffed so they can continue to provide care. As more doses become available, more people will be able to get the vaccine. As long as there is limited supply, we will work towards equitable allocation that supports people who are at highest risk. We anticipate that it will be available for the general public by spring, but that may change depending on how the vaccines are approved and how quickly doses are manufactured. These vaccines will be distributed at 5 regional sites we are setting up with our partners in the initial phase. The most effective way to distribute a limited supply of vaccine to these specific groups is by us setting up these 5 sites. This is a Herculean effort, and public health has been working towards this for months. We have taken all the planning we in public health do for emergency response, and we've adapted it to this specific situation. We would not be able to do this and implement this important and immense plan to administer thousands of doses of vaccine in a few short weeks without our amazing partners. I'd like to recognize them now. Abrazo Health, Banner Health, Dignity Healthcare, Honor Health, the National Guard, local emergency managers and planners, EMS, medical volunteers, and so many more. We know that many people have questions about the safety of this vaccine. We will be working with external, non-governmental review board who is looking at the data. This group is made up of scientists, medical ethicists, medical experts, pharmacists, and others, and is separate from the review that the FDA is conducting. We want to do our due diligence to be sure that the vaccine is safe and effective for our community. The vaccine is a sign of hope that we have been looking forward to, but it will be many months before most people will have the chance to get the vaccine. Right now, we are seeing the highest numbers of cases we've seen, and it's likely that we will pass our previous peak. We've all heard what we can each do to slow the spread. Instead of repeating them, I want to focus on a few. Stay at home when you're sick. In a pandemic, you can't assume that symptoms are something mild. We know that some people can have mild to no symptoms, and they are just as able to give it to someone else who will end up with severe illness. So please stay home when you are sick. Avoid large groups of people, even family. The larger the group, the more likely you are to be exposed. I know this is hard, especially during the holidays, but thankfully we have many, many ways to be able to communicate and connect with our loved ones. Answer the phone when public health calls. We can help you understand what to watch for, where to get resources to help you, and help you understand your isolation and quarantine guidelines. And it helps us to inform your contacts so they can reduce the spread before they have symptoms. Thank you.
Thank you, Director Flanagan. So we mentioned, as Marcy mentioned at the very beginning, she gave a presentation, a pretty lengthy presentation to the Board of Supervisors this morning. That video is on our YouTube page as well if you want to see the full presentation that will be given to a number of people and a number of interested parties as the weeks go on, and that'll continue to evolve as we have more information about approvals of vaccines and that sort of thing. So at this time, we'll open it up for questions for Director Flanagan and the other subject matter experts I told you about. So with that, Ron, do we have anybody on the line?
Yes, Fields. At this point, Cameron Pullum has asked a question, and he doesn't have audio. So his question is, how many doses are in the initial round? How many of those doses are going to long-term care facilities? And what is Maricopa County's Group 1A population?
So how many are going to long-term care facilities? How many people are in the 1A population? What's the estimate on that? And how many are we getting in relation to that? So Marcy Flanagan can come up and give us at least a broad and a high-level view of what's going on with that. She presented about that at the board meeting this morning.
So our initial focus for the 1A, Phase 1A population in Maricopa County is approximately 123,000 people. That consists of healthcare workers who are at highest risk to COVID and COVID-infected materials, and so that's who we will be focusing that initial phase on. The vaccine that is going to the long-term care providers and the long-term care facilities and the residents in those facilities will be administered through a CDC pharmacy program, and that vaccine will come off of the initial vaccine allocation coming to Arizona. However, they won't be part of the first shipment that comes to Arizona. Our latest reports are showing around 40,000 doses, but again, things are on a daily basis changing as more information becomes available on what Pfizer has. That's when we know how much vaccine. As soon as it's approved from the FDA, that's the first trigger that needs to happen. Then it'll go into the next of how many doses they're going to have available to manufacture, how many come out in that initial shipment, and it kind of goes on from there. So initially, we're planning for about 40,000 doses to concentrate on that 123,000, and from there, where other supplies will have initial amounts come off and go to those pharmacy providers who will be going into long-term care facilities and providing the vaccine to the residents and staff.
Y la pregunta es cuántas dosis habrá y cuántos irán al centro de cuidado de largo plazo, a los centros de cuidado de largo plazo. Bueno, ¿y cuántos son del grupo inicial llamado 1A? ¿Cuántas personas habrá al final que serán vacunadas? Bueno, nuestro enfoque son 123,000 personas al principio, empezando por los trabajadores de salud, de cuidado médico, que están en más alto riesgo de contraer COVID-19, también por el material que ellos utilizan. También para las personas de cuidado a largo plazo, es un programa separado que viene del Centro de Control y Prevención de Enfermedades, que trabajará con las farmacias para ir a estos centros de cuidado a largo plazo y vacunar a los residentes. Al principio se esperan 40,000 dosis para este grupo de 123,000 personas, pero antes que hablar de cantidades, esta vacuna tiene que ser aprobada. Después iniciaremos, todo esto está cambiando constantemente. De ahí habrá o partiremos para ver a dónde irán las vacunas.
Thank you, Cameron, for the question. Ron, do we have somebody else?
Yes, Fields. Ann Ryman is up next. Ann Ryman is unmuted.
Hi, thank you. You mentioned in the presentation this morning to the supervisors that pharmacies would be taking some tests, quote, off the top for distribution for long-term care residents. How many long-term care residents are going to be vaccinated on this first round? And is that enough to cover all of them? I'm curious where the long-term residents fall in order with the healthcare workers.
Yeah, I think that's what Director Flanagan was just referring to a moment ago as she was answering Cameron's question as well. This initial number of doses, 40,000 is the estimate right now, but that's continued to change on a daily basis. I know that Marcy can expand on that a little bit, but it's also two separate programs, what we have going on with the pods in the 5 districts around the county, as well as what's going to be going out through the pharmacy program, and that'll happen at the state level. So, Director Flanagan, you expand on that a little bit?
Hi, Ann. Thank you for the question. So the state is really helping coordinate this effort that's in the long-term care skilled nursing facilities, and that pre-shipment is what they're calling it. The first shipment that comes will just be going to Maricopa and Pima counties. None of that initial shipment will be going to those pharmacies, but the number of providers, pharmacies that sign up for that program, it's still ongoing. They're still recruiting for that. We also have vendors that will be helping us with that. And we can get back a better, more specific number, but estimates around 60,000 individuals live in these facilities that would qualify for the vaccine through this program.
Oh, I'm sorry, Joanna.
La pregunta es que esta mañana se mencionó en la Junta de Supervisores en la presentación que las farmacias son las que irán a los centros de cuidado de largo plazo. ¿Y cuántas dosis esperan que lleguen a estos centros de cuidado de largo plazo? Bueno, mencionamos anteriormente que son aproximadamente 40,000 dosis las que se esperan en el primer cargamento que llegue, pero eso cambia constantemente. Hay 2 programas diferentes, ¿no? Uno es el que está que el Condado Maricopa está tratando de hacer con los puntos de distribución y lo que viene siendo las farmacias, que es separado. El Estado está coordinando los esfuerzos con los centros de cuidado médico de largo plazo, y también las primeras dosis que llegarán al Condado Maricopa y Pima, y son alrededor de 60,000 individuos en los hogares de largo plazo que son los que califican para ponerles estas vacunas.
I was so eager to get up here, I almost stepped on Joanna. Thank you very much, Ann, for the question. Ron, who do we have next?
Yes, Irene Snyder is up next. Irene?
Oh, Irene, okay.
Your mic is muted on your end. You'll need to unmute your mic.
Irene, can you unmute your mic on your?
There we go. I think I'm unmuted now.
We have you.
Okay, thank you very much for your time. I've seen plenty of articles stating that kids won't be able to get this particular vaccine. Do you know at this point how long it might be until there'd be a vaccine available for children? And even past that point, too, what it'll mean for schools if teachers are able to get the vaccine and the students cannot?
All right, thank you, Irene, for the question. So you want to know how long it will be. I'm not sure we know a specific date or anything like that as to how long it will be for children to start getting vaccines, but then it would start to affect schools as we move forward. So Director Flanagan can address this.
Thank you, Irene. So as far as a vaccine being available for kids, we won't know that until more data is released by the FDA and who they actually approve. We know the vaccines that are in the pipeline to be approved right now are safe. However, specific details about youth and when they'll go to youth and what vaccines will be used is forthcoming. The teachers are really prioritized because of them being adults and being most vulnerable. And that's what this initial Pfizer and Moderna are really going to focus on. That's why they're intended for the adult populations, and that's how we're prioritizing kids, because this hasn't affected them as much, are lower on the priority for receiving the vaccine. But again, as more data becomes available, as the final trial information becomes available, all of the data and us being able to analyze that and look at that will come in the weeks and months to follow.
La pregunta es, muchos artículos que han salido a la luz y que dicen que no habrá una vacuna para niños al inicio. ¿Y qué pasa cuando los maestros obtienen la vacuna, pero no los estudiantes, los jóvenes o los niños? Bueno, la vacuna para niños no sabremos exactamente cuándo estará disponible porque eso está cambiando constantemente. Y eso tiene que ser aprobado principalmente por la Administración Federal de Drogas y Alimentos. Y no se tienen estos datos al momento. También los maestros, como son personas adultas, sí califican porque están en la línea combatiendo precisamente rodeados de muchas personas y sí califican para la vacuna ya sea de Pfizer o Moderna una vez que estas sean aprobadas. Los niños, como no les afecta tan severamente la enfermedad como los adultos, tendrán que esperar.
All right, Irene, thank you so much for the question. Ron, do we have somebody else on the line?
Yes, Katie Davis-Young. Katie, your mic is unmuted.
Hi there. I understand that doses might be arriving as early as next week. I was hoping you could talk a little bit about the 5 regional sites that you'll be using for those earliest doses. Where are they and where are they in the kind of setup process? Are you doing dry runs? Are you getting tents set up? What are those going to look like?
Because these original doses, they are going to they're going to specific populations, medical workers. Marcy, you want to talk a little bit more about that? Because we do have 5 different regions. They're called pods. And Marcy, explain a little bit more about that.
Hi, Katie. Thank you for the question. So the 5 regional area or pods, which are point of dispensing locations, that initial shipment that you're referring to that we do hope arrives next week will be going to 2 of our locations. Our central location, which is Banner, overseeing that location and that pod operations, and then our northeast valley, which is an honor location. And the dry runs are already happening starting this week and next week. Absolutely, we are fine-tuning everything before we actually get the vaccine and start to open up the pods and have those individuals come in and receive the vaccine. So all of that has been ongoing. Sites have been operationalized and setting up for several weeks now. These are plans that have been in the works for many months, and so all of our partners are already, even all the sites that wouldn't be going live next week have already started walking through the processes to make sure it's as smooth as possible.
pregunta es que las dosis que llegarán la semana que entra, ¿en dónde estarán estos 5 puntos regionales donde se distribuirán? ¿Cuáles son esos 5 puntos? Bueno, cabe mencionar que son 5 regiones en puntos de distribución que se les llama, o conocidos en inglés, pods. 2 de ellos están en el centro, en el área central, bajo Banner, y también en el noroeste, también en Banner. También se pregunta que si se ha estado haciendo algún tipo de simulacro para saber si esto va a funcionar. Y sí, efectivamente, los ejercicios o simulacros ya han estado pasando por varias semanas, se han estado llevando prácticas para hacerlo más eficiente una vez que esta vacuna sea aprobada y llegue aquí a nuestro valle.
All right, thank you very much. I believe that was Katie, right? Thanks, Katie, for the question. Ron, who do we have next?
Peter, your mic is unmuted.
Go ahead,
Alrighty,
Peter.
thank you. Good afternoon. So I know the county is helping with distribution. Are any of these vaccines going straight to the providers, straight to hospitals, anywhere outside of a public health entity?
That's a good question. Thanks, Peter. The answer is interesting. So providers come a little bit later in the list, and Director Flanagan will explain that.
So thank you for that question. Certainly all the vaccine that arrives in Maricopa County for COVID-19 is being allocated by public health. However, it's a direct shipment to the location that we determine. So initially, the initial shipments are going to come to those 5 regional sites, but the allocation, how much goes to each of those sites, that's all determined by local public health. And as more vaccine becomes available and we expand beyond those initial phase 1A, we'll start to expand the number of providers and locations that we are allocating vaccine to.
Bueno, la pregunta es que si el condado está ayudando con la distribución de estas vacunas, pero que si la vacuna va a llegar directamente a alguno de los proveedores. Bueno, la respuesta es que la vacuna que llegue aquí al condado Maricopa, toda llegará al Departamento de Salud Pública del condado Maricopa, pero va a ser directamente entregada a los sitios ya designados para que pongan estas vacunas. Esto ya se ha trabajado, ya se ha coordinado y ya está listo para realizarse en caso de que llegue la vacuna.
All right, thank you so much for the question. Ron, we have a follow-up question from somebody, is that correct?
Oh, we do. Cameron Pullum had a follow-up question.
Okay, you want to just go straight to that? All right. So this was a couple of questions that came in from Cameron, and Director Flanagan already covered this to some extent, but we'll pose it one more time in a different way. Can you speak further about the pods for this initial group, how that will change once we expand to groups 1B and then 1C and so on, and then how the smaller providers, I assume that would mean medical providers, have been approved to distribute the vaccine in Maricopa County.
So as I mentioned, the initial vaccine that comes in, it will be more controlled in these 5 regional pods. As more vaccine becomes available, and as you can imagine, we move through these other phases, 1B, 1C, there'll be additional providers that we allocate vaccine to, and then it opens up. And then you can imagine one day when this vaccine becomes just like any other vaccine, you'll be able to go to your primary care physician, to a pharmacy, to an urgent care center, any of those sorts of places, a federally qualified health center to receive the vaccine. But we're not probably anticipating anything looking like that until next summer. Again, all these timelines are just our best guesses for what we know today in public health and what we've heard from our pharmaceutical partners, the FDA and the CDC. But that's when you'll start to see, as more vaccine becomes available more and more, there'll be less kind of control of who's getting it and how we're allocating it to our community.
Bueno, vamos a hacer una pregunta de una forma diferente, ya se había hecho, pero para explicar un poco mejor. Podemos hablar un poco más de los puntos de distribución a los conocidos como PADS y cómo los proveedores también van a ser aprobados para recibir la vacuna. Bueno, al principio será controlado solamente por el Departamento de Salud Pública del Condado Maricopa para 5 regiones de las que ya hablamos. Y cuando existan más vacunas, vamos a entrar a otras fases. Entraremos a la fase 1B y 1C y daremos más vacunas a estos sitios. Pero no sucederá esto, se cree que hasta el próximo verano porque no existen las dosis ni tampoco la vacuna ha sido aprobada. De acuerdo a lo que viene dando información también CDC y también la FDA o la Administración Federal de Drogas y Alimentos.
All right, thank you so much, Cameron, for those 2 follow-up questions. Ron, do we have anybody else on the line?
Yes, Fields. Allison Steinbach has a question. Allison, your mic is unmuted.
Hi, thanks so much for doing this. So given the finding from the antibody study this summer that 11% of the county had been infected, I'm wondering what your current thinking is on what percentage of the population needs to get the vaccine to reach herd immunity.
All right, thanks for the question, Allison. So Allison referring back to the Sero survey that was done on a controlled group in September, and we presented the results of that last month. So Director Flanagan can expand a little bit on that.
Hi, Allison. So the studies that are available right now are saying that we need anywhere between 50 and 80% of our population vaccinated. The Sero survey we did that told us that almost 11% of our population has antibodies built up. You can say the difference between those is how many we'd want to get vaccinated. However, with this being a really new virus, we are going to ask even individuals who have been infected when a vaccine becomes available and when their population has been identified as being a group that's ready to receive vaccine, that they still receive the vaccine. We don't know how long those antibodies are going to last from having a COVID infection, and so it's best to get the vaccine when it is available.
La pregunta es que hicimos un estudio donde se reveló que el 11% de la población del condado Maricopa ya había sido infectado con COVID-19. ¿Y cuánto porcentaje de personas entonces deben de ser vacunados para tener una inmunidad comunitaria? Bueno, el 50 al 80% se necesita ser vacunado para tener esa inmunidad comunitaria. El estudio que realizamos en septiembre de los anticuerpos en el condado Maricopa reveló que el 11% de las personas o de la muestra ya tenía anticuerpos. Pero cuando exista la vacuna para todos, vamos a pedirle al público que se vacunen completamente, independientemente si tuvieron la enfermedad en el pasado, porque no se sabe si los anticuerpos durarán por cuánto tiempo, si tendrán inmunidad para una segunda vez que se puedan enfermar.
Thank you, Allison, for the question. Ron, does anybody else have a question?
Yes, Fields. Juan Juarez is up next. Juan, your mic is unmuted.
Hi there, thank you. Sorry, I wasn't able to join the WebEx earlier, but can you guys just provide some clarity or some understanding messaging for the vulnerable communities, those that don't have insurance, the undocumented population that lives here in Maricopa County, about access to the vaccine? A lot of people are, of course, worried if this is going to be something that's going to harm them in the way of their immigration status or anything like that. Can you just provide some clarity for those vulnerable populations that either aren't, with the legal status or that are vulnerable and older that maybe want to have access to the vaccine? How's that going to work out for them?
All right, Juan, thank you so much for the question. Well, I think whenever it comes to communicating to all populations, it kind of starts with the meeting this morning, this press conference now. Our medical partners have already been out there and demonstrating what the pods are looking like and how they're going to function. And I the news media, the reporters who are on the line here, and those people that consume this press conference later, whether it's on Facebook or YouTube, you're a part of this this communication as well. So we hope this continues to get spread out there, because we want vulnerable populations to know that the vaccines are safe. They won't be distributed unless they're safe, and there's been a lot of study up till this point. Director Flanagan can expand on my limited knowledge on this.
So the vaccine there will not be a charge for the vaccine. It will be free to receive the vaccine. And we, at any of the locations where we're providing vaccine in the community, we don't ask for citizenship. We want everyone who lives in our county to get vaccinated to help protect and reach that herd immunity. So that's going to be really important to us. It's also important that we're working with our community partners, our interfaith group, our nonprofits, the agencies that are disproportionately affected, those of races of color, those people of color, the refugee populations, individuals who speak a language other than English, all feel that the vaccine is safe and that it is important that they receive the vaccine. So we'll be working with all of those partners moving forward. And as soon as the vaccine becomes readily available in the community, it's going to be really important that everyone in the community understands the safety of the vaccine and has access to receive the vaccine.
Bueno, la pregunta es que si podemos clarificar el mensaje para las personas que quizás no tengan seguro médico o personas que no tienen un estatus legal en este país. ¿Qué se les dice a esas personas con referencia a la vacuna del COVID-19? Cuando comunicamos con toda la población lo hacemos a través de las conferencias de prensa, usamos diferentes idiomas y también esta mañana nuestra directora habló ante la Junta de Supervisores, pudieron ustedes ver esa presentación, al igual que también lo hicimos a través de los simulacros para poder que la comunidad se entere qué es lo que está sucediendo y puedan tener mejor conocimiento de este tipo de vacunación que llegará próximamente. Bueno, vamos a mencionarles también que la vacuna es gratis y va a ser gratis y no se pedirá ciudadanía a ninguna persona que llegue y que sea del grupo que pueda vacunarse. Para alcanzar la inmunidad comunitaria es muy importante que la comunidad se vacune independientemente de quiénes sean. Estamos trabajando de cerca con grupos de fe, con grupos de personas refugiadas, personas que no hablan el inglés y para que ellos tengan el acceso cuando ya esta vacuna esté disponible para la comunidad.
Thank you so much for the question. Ron, do we have somebody else with a question?
Ms. Fields, Ann Ryman has a follow-up.
Okay.
Ann, your mic is unmuted.
Thank you. So just to clarify, will county public health have any role at all in distributing the vaccines to long-term care, or is this all being done by CDC and the state? And secondly, I also wondered, the president of the American Healthcare Association this morning said his group is pushing a goal of having all long-term care residents and employees who work there receive a second dose of the vaccine by March 1st. And I was wondering, given what you know now, how likely is that to happen, to have them receive both doses of the vaccine by March 1st?
All right. Thank you so much for the follow-up question, Ann. Do we have a role in long-term care vaccination distribution was your first question, and then you wanted us to respond to this hope, or I don't know if I should call it a demand, but this expressed interest in having all residents of long-term care facilities receive their second dose by March. So Director Flanagan will come up and answer that.
So, Ann, it's important to know a few things. First is that skilled nursing facilities are going to be prioritized, and all of those have already been registered through the CDC program and have pharmacies that are on board ready to go and to provide vaccine. Long-term care facilities, they're still working on getting everyone registered, and so public health will fill in for the long-term care and these other sort of assisted living facilities that don't get registered through the CDC program. We'll work with our staff and vendors to go in and fill in those gaps, but the large majority are going to be handled through the CDC pharmacy partners ownership. The other question you asked was about if 2 doses by March. As long as the supply chain is consistent with what we've been hearing, that should be a reasonable goal. Again, if something happens during manufacturing and there becomes, a curveball or something that really prevents the amount of vaccine that they would like to have ready by March being available, that may change. But at this point, I think that could be very likely.
Okay. La pregunta es que si podemos clarificar el rol de salud pública que tendrá en distribuir la vacuna en los centros de cuidado de largo plazo. También hay una segunda pregunta que el presidente de la Asociación Médica mencionó esta mañana, que todos los que se vacunen y que tengan 2 dosis específicamente para estos centros de cuidado a largo plazo, y que si puede ser factible para marzo, que van a intentar de que eso sea posible. Bueno, la respuesta es que estos grupos que viven en los centros de cuidado a largo plazo son de prioridad, siempre y cuando se hayan registrado con CDC o los Centros de Control y Prevención de Enfermedades con anterioridad. El resto, si no se ha registrado y cuando llegue la vacuna al condado Maricopa, podemos hacer una colaboración para que exista esta vacuna en esos lugares. También acerca de las 2 dosis para marzo. Bueno, sí podemos dar 2 dosis para marzo si es que todo está como se planea. En caso de que exista algún cambio, eso pudiera variar. Pero al momento pudiera ser factible que sí se pudieran dar 2 dosis para marzo.
Thank you for the question. Ron, do we have anybody else?
Ms. Fields, Josh Sanders is up next.
Okay.
Josh, your mic is unmuted.
Hey, thank you. Just a point of clarification. I have a couple follow-up questions for the directors. The initial distribution allowed for taking after the FDA grant authorization for 20,000. That's just for Pfizer vaccine and just for those phase 1 priority healthcare workers, not long-term care facilities, especially for staff.
Hey, Josh, I'm going to stop you there. We can hardly make out your audio on this end of it. It sounds like, I don't know what your connection is like or where you are, or your microphone is really, really muffled. So if you can clear that up.
Can you hear me now?
It's still pretty rough. Go ahead. It sounds like you have a fairly complicated clarification here, so I want to make sure we hear it correctly.
Okay, just the initial, after the FDA grant authorization, Arizona will get 40,000 doses of the Pfizer vaccine.
Okay, so sorry, Josh, we lost you there. That is correct that Director Flanagan did say that 40,000 is the expected number of doses once there's approval of the Pfizer vaccine. Your audio got even worse toward the end there. If you want to log out and log back on, we'll be on here for a couple more minutes. I want to make sure that you get your questions answered if we can. So I'll give you a moment. Do we have anybody else in the queue? And then we can go back to Josh.
Yes, Fields. Allison Steinbach has a follow-up.
Okay. Go ahead, Allison.
Hold on. Allison, your mic is unmuted.
Sorry, I think that was actually my question also, although I didn't really hear that question. But I thought I had heard 60,000 this morning and now 40,000. So I just wanted to make sure I understood what that expected number is.
Okay, so I think the number is shifted as Director Flanagan indicated. It's changed daily, but you can come up and talk a little bit more about where that number is at the moment.
So as Field says, this is rapidly changing and evolving, but the 60,000 is what we're hoping reaches Arizona. The allocation coming to Maricopa County is in the 40,000s. As I mentioned this morning, we'll be sharing that initial allocation that comes to Arizona with Pima County. Those will be the first 2 counties to receive this initial Pfizer vaccine and distribute it in the community. So again, I wouldn't say that's a firm number until the vaccine's actually received here in Arizona. We're going to see fluctuations when these numbers and how much vaccine actually makes its way to Arizona. But certainly when the vaccine is in hand and we can announce that exact number of how much we have received, we can do that.
Bueno, hemos escuchado 2 números, si quieren clarificación acerca de si son 60,000 o 40,000 dosis las que se esperan aquí en Arizona. Bueno, este número está cambiando constantemente, rápidamente. Entonces queremos que Arizona se cree lleguen 60,000 dosis, pero de ellas 40,000 llegarán al condado Maricopa. El resto de las 20,000 más se esperan para el condado Pima. Pero ese número puede cambiar constantemente y hasta que no lleguen a Arizona podremos dar un número exacto.
So we have time for about 1, maybe 2 more questions. Ron, who do we have?
Fields, we can see if Josh is able to reconnect again.
Okay.
Josh, are you there?
Josh, we're just not hearing you.
Can you hear me now?
It's still just as bad as it was before.
Sorry, guys. I'll follow the email. Thank you.
All right. We appreciate your patience, Josh. Sorry we're not connecting today. Ron, do we have somebody else? All right. Thank you so much, everybody. We appreciate you helping us get information out about this vaccine. As we've talked about a number of times, the numbers are in flux right now as to how much will be coming here. Of course, this is all pending the approval that we expect to happen and we hope to happen, but that is still on standby until later this week, and then we'll know a little bit more about that particular vaccine. A lot of discussions to be had over safety and the review of this vaccine and to make sure it's safe in our community. We want to definitely get that word out there that people are working toward that end, making sure it's safe before it is administered in our community. So with that, I'll also remind people it's not too late to get your flu shot. Remember, you can do that. Stay out of the hospital. Don't get sick this winter, at least from the flu, and protect yourself. If you have questions about Maricopa County programs, you can go to maricopa.gov/COVID-19. We have a lot of information there. I know reporters are very familiar with our website and the web pages that we've put up in relation to this, but we have information about programs, free flu shots, free testing, a number of things that you can find there, as well as the school's dashboard as well. So a lot of resources depending on what you need, but it's all there on maricopa.gov. So we appreciate your time today. Thanks so much for joining us, and we'll see you next time.